I'm Anderson Cooper of CNN. I'm really pleased to tell you about HealthCare Chaplaincy's bold vision as it enters its second half-century. 50 years ago, who could have imagined the tremendous advantages in American healthcare that we take for granted today? 50 years ago, who could have imagined that professional chaplaincy would have found its proper voice as a strong advocate for integrative care, three-quarters spirit, mind, and body? 50 years ago, who could have imagined that healthcare chaplaincy would have helped more than 5 million people find comfort and meaning? That's greater than half the current population of New York City. 50 years ago, when it was common for family doctors to make house calls, who could have imagined that today federal law would say that those old-time values of providing patient-centered care that is accessible, affordable, and effective are still important? It is essential that we provide patient-centered care for those with serious life-altering illness. This need is rising as the baby boom generation ages and the population of elderly grows. Patient-centered care and palliative care are one and the same. Palliative care helps people to live well and live fully. It reduces suffering. It matches treatments to a person's wishes and values. Palliative care is concerned about and embraces the whole person, with no barriers, no limits, no conditions attached. The palliative care team includes physicians, nurses, social workers, professional chaplains, and others. The New York Times reports that palliative care is one of the fastest growing fields in medicine. Palliative care is what professional chaplains have always provided. In fact, the Wall Street Journal properly described healthcare chaplaincy as a palliative care nonprofit. Now, healthcare chaplaincy is preparing to build America's first palliative care campus. This facility and its programs will transform American healthcare as we currently know it. Within this campus, pioneering research will take place. Healthcare professionals will come to learn and teach. People who are coping with serious life-altering illnesses will find a home and a caring community that will help them to live well until they die. The campus will be housed in a beautifully designed, environmentally sustainable, iconic building that will add grace and elegance to the New York City skyline. The building will be located on South Street in Lower Manhattan, overlooking the FDR Drive and East River. The campus will house healthcare chaplaincy's research, education, clinical practice, and administrative staff in one place. The heart of the campus will be a New York State licensed enhanced assisted living residence for 120 people with serious life-altering illnesses. They'll receive the finest care possible. The campus will include a palliative care medical home group practice that will serve both the residents and the people who live in the surrounding neighborhoods. The campus will create a welcoming, collaborative, and life-enhancing environment for all who live here, all who work and study here, and all who visit. Now it's my pleasure to introduce the President and Chief Executive Officer of Healthcare Chaplaincy, the Reverend Dr. Walter J. Smith of the Society of Jesus. Father Smith?
Thank you, Anderson, for helping to recreate, through words and images, the story of healthcare chaplaincy. I am proud to be part of a leadership team that continues to make a difference in the lives of people who are sick, disabled, aging, or facing death. Plato understood it so well when he said, "If the head and the body are to be well, you must begin by curing the soul." For 50 years, we have been curing the soul of New York. And now, for those living with life-altering and irreversible illnesses, we are imagining new ways to make spirit-centered palliative care available and affordable in America. Is this just a dream? Well, not for healthcare chaplaincy. We believe we have the expertise and experience developed and proven over the past 50 years to make this dream a reality. Through our imagination, innovation, and inspiration, we will create America's first palliative care campus. In the year 2061, when our successors gather to celebrate the centennial of healthcare chaplaincy, they will recall the 50th Jubilee year with awe and appreciation. They will recognize that the words imagine, innovate, and inspire were more than an anniversary tagline. They were the drivers of a movement that changed the face of end-of-life care in America. Thank you for helping us to realize this dream and to fulfill our mission.